Welcome, everyone. We're really pleased to be here today. If you wanted to, so I'm Teresa Atkinson, and I am a patient partner, as you may have seen in the notes. And I have the privilege to work on some research projects with Leah, and we're excited to be here today to share storytelling for impact and how that helps patients share their story and create a better future for tomorrow. And I'm here with my friend and colleague, Leah Getchell, and I will let you introduce yourself, Leah. Thank you.
Awesome. So hi, everyone. Again, my name is Leah Getchell, and I'm a trained anthropologist and social worker, and I'm currently the renal modality coordinator here in the Southwest Regional Renal Program in London, Ontario. We do have a River Thames, fun fact. And an important practice for us in Canada as we work through truth and reconciliation in the way that we engage and have caused harm to the Indigenous peoples in our land as settlers. We like to acknowledge the first peoples of this land. And so our CanSolve CKD network conducts their work. Our head office is on the traditional unceded territories of the Coast Salish, home of the Musqueam, Squamish, and Tsleil-Waututh nations. Here in London, Ontario, where I'm on the traditional lands of the Anishinaabeg, the Haudenosaunee, the Lenape'wak, and the Chundocton nations. And I'm so grateful to go down to the river, the Dishkin-Zybig, or the Thames River here in London, and so grateful for their ongoing stewardship of the land that I'm on. Teresa, did you want to
Awesome.
share?
Yeah, I'd love to. So I get to live and work and play in beautiful British Columbia, and I'm in the interior in the Okanagan Valley, which is the traditional unceded and ancestral home of the Sealox Nation. And the Sealox Nation is actually made up of 7 villages or communities, if you will, that cross the international border. So they're pan-Canadian, and or sorry, they're Canadian and U.S. members in their nation. So we know stories have impact, and that this is a way that we connect with one another. And so we have, oh, I got ahead of myself. I'm so sorry. So today we'd like to share with you the understanding and the importance of storytelling in the context of healthcare, how that impacts healthcare, gaining insights into the educational model that was co-developed and delivered with patient partners like myself, and to review the resources and how you might use these in your own life and practices. Thanks, Leah. And so now we know that storytelling is so impactful, and that's how we relate with each other. It's how we express empathy and make connections. And we know everyone has a story. So we do have a poll for you. And if we could pull up that poll, have you ever been asked to share your personal story? Whether you're a healthcare provider or a patient partner, we'd like to know if you've been asked. And did you find it challenging to prepare for that? Also, were you satisfied with how your story was received when you presented it? And did you know the impact of what your story had on the audience? And I think we have the majority if we wanted to end, and I'll pass that to you, Leah, to share.
Yeah, well, it's just so interesting to look at it that many of you on the call have been asked to share your story. And that there was, at least half of you that responded said it was kind of difficult to prepare. Some of you thought that yes, it was, or only a few of you that thought that it wasn't. Most of you were satisfied with how it was received, although most of you again weren't actually sure. And this is not surprising in that we don't often know how our stories impact the audience. So thanks, Oliver, for putting that up. And thank you for engaging with that. And maybe we can bring back some of that discussion in the question and answer. So yeah, so as Teresa said, we're inherently storytellers as humans, and we've been gathering together to share our stories, hear stories from our ancestors since the beginning of time. And in the healthcare context, hearing stories allows us to deeply understand and honor and learn from those who have the lived experience, particularly, in our world, and it's the experience of kidney disease. And it allows us, particularly in the health research context, to hear stories during different stages of the research process so that they can be helpful and ensure that the research that we're doing is really aligned with the priorities of our patients and families. And I'll just say here, because we're in an international context, so in Canada, language is always changing in terms of how we refer to the folks that we work with. In our network, we use the term patient partner, and that is what our patient partners wanted to be called. And that includes patients with chronic kidney disease, informal caregivers and family. It also includes living kidney donors, which is unique to our population. So I just wanted to give you a little bit of context about who we are here in Canada, the network that we're representing, what is the Storytelling for Impact module, and then I'm going to hand it over to Teresa, and she will share how she got involved in her experience, and then we'll share how you can access the tool, and we'll talk a little bit about sort of lessons learned about co-creating something like this with our patient partners. So I don't know if many of you have heard of SPORE, and of course, if you're in the health research world, everything is an acronym. So the Strategy for Patient-Oriented Research is a strategic initiative funded by the Canadian Institutes of Health Research. It's a partnership between researchers, those with lived experience, healthcare providers, and policymakers, with a commitment to create a collaborative research environment. And when we often talk about patient-oriented research here in Canada, one of the reasons I think that this started happening around the world, and for us, and SPORE was created in 2011, was because we recognized that the healthcare system was in crisis and we needed to do something differently. And so, this idea of bringing those who are end users or interest holders in the research to the research table to help us co-create research would ultimately help us close the gap between on average 18 years it takes from bench science to make it to the bedside, right? So that means with that large gap, translational gap, we're often not using best practices in healthcare. So this is an attempt to provide better care for our patients. So in 2016, the Strategy for Patient-Oriented Research funded us. We are the Canadians Seeking Solutions and Innovations to Overcome Chronic Kidney Disease, CanSolve CKD. I never know what comes first, the acronym or what it stands for. So we are one of 5 chronic disease networks that were funded through the Strategy for Patient-Oriented Research, because we know folks with chronic kidney disease or chronic illness in general take up, is a large portion of the folks that we support in our healthcare system. So, for example, here in Canada, you can see that there are on average 4 million people living with chronic kidney disease. That's about 1 in 10, and I believe that average is about the same worldwide. So our network is 120 researchers, 75 patient partners, and the group came together and did a national priority setting, had a national priority setting consensus conference, and identified the top 18 research projects that were important to this group of stakeholders. And so CanSolve CKD is the infrastructure to support these research projects. through a patient-oriented research lens. And patient engagement and patient partners are at the center of our network. I will just pat myself and us on the back. I think we have been leaders in this work over the last 6, 7, 8 years. And this simplified governance structure really highlights how patient partners, the original term was patient council, it's now the Patient Governance Council, and our Indigenous Peoples Engagement and Research Council, or IPERC, really are the bedrock or at the center of all of the things that CanSolve does. It's important for us also to have this distinct Indigenous voice because our Indigenous friends and colleagues are exponentially more at risk of chronic kidney disease than non-Indigenous folks. So one of the committees relevant to the work that we're sharing with you today is called the Training and Mentorship Committee. And this is a group of patient partners, researchers, clinicians, health policy folks, and community partners who were tasked at the inception of our network to create tools and resources to help these 120 researchers and 75 patient partners learn and figure out how to do this thing called patient-oriented research. So again, I'm talking here in the past, 2016, 2017, when the network started going. We've certainly learned a lot from that time, but we were really building the plane as we were flying it, which we often referred to. So we received this funding. We kind of, in essence, had an idea about what patient-oriented research could and should look like, but the how was the work of this mixed group of folks. And to be honest, it was a bit of a wobbly start. So when you think back to the early days of PPI, patient and public involvement in research, patient-oriented research, you know, there was an increased ask for patients to share their story. And that could be in various settings, right? So it could be at a research team meeting, at a conference, or at a training event. Well, in the spring of 2017, our network had patient partners join what was up until that point solely scientific academic conference. And there was a sense of discord after the meeting. Neither the patient partners nor the audience were adequately prepared for this new exchange of energy and ideas. The patients felt that there was a perceived lack of misunderstanding from the researchers, and the researchers, on the other hand, expressed difficulty with the emotion that was shared by patient partners. Now, as a social worker, sitting with difficult emotions is my job, and it always surprises me that it can be so difficult for other folks in healthcare. And so this was a real light bulb moment for us. We thought, if this patient-oriented research thing was going to be successful, we had to do something different in the way that we set the stage and supported patients in participating in this new environment. And we needed to support the researchers and clinicians to receive this really important and new perspective. And so it was the Training and Mentorship Committee then that sent out a network-wide training survey a few months after this conference in 2017 and asked the network what were their top training needs for patient-oriented research. And the number 2 result out of the top 5 was telling impactful stories. So that set us off on a course, among many others, to think about and get curious about what a tool might look like to support patients in sharing their stories in this health research environment. Now, luckily for me, it didn't take long and we didn't need to reinvent the wheel. So I was working here in the Health Research Institute out of London Health Sciences Center, and I came across some colleagues in our patient experience office. And they had already created a 1 day in-person workshop for patients who were developing their story with the goal of being a part of corporate orientation at the hospital. So where new trainees, new staff, new physicians come and hear about the hospital. And what really resonated for me in what this group had created was their shift away from having patients retell a linear or chronological tale of events that sort of, was the first I was diagnosed then, and then this happened, and then this happened, which we often hear and can be helpful. But this group focused on having patients reflect on moments of care. And in those moments of care, which elements of patient and family care were being highlighted or were missed in those moments of care? And then they would share this with the new hires at the hospital to really sort of drive home the importance of, a patient and family centered model of care at the hospital. So I would encourage you, when we send these slides out, to click on these two links below. This will take you to the two publications that came out of the work that our colleagues did. We can't get into it. There's much more to say about it. In particular, the narrative medicine lens that they incorporated into their work. So this is put this on your sort of action items for after the workshop. So the training and mentorship committee, so I let my colleagues at CanSolve know that I had come across this workshop. And so we invited Lisa Hawthorne-Thwaite and Mim O'Dowda. So Mim was the patient partner and Lisa was the patient experience office staff, and Lauren Lee, to come to our in-person training and mentorship committee meeting and sort of tell us, how they supported patients in creating these stories. And so what followed was the creation and adaptation of their 1 day in-person workshop to an online experience so that it would support our national kidney research network. So we ran our first pilot of this new version of this workshop in the spring of 2018. And so rather than 1 day, it consisted of 3 online group meetings, as well as 3 individual coaching calls. And our very first 3 brave storytellers, Gwen Harrington, Chantal Large, and Marion Reach, presented their stories in May of 2018 at the Canadian Association of Nephrology Administrators Summit in Montreal. And the impact and the feedback was fantastic. One individual said that it was incredible and passionate, that they added a lot of values and perspective to the conference. It was inspiring and a great reality check. Always great to hear from the patient perspective to know if we are doing a good job. So this was a real win for us, and it was a 180-degree turn from the experience of having patients share their stories the year before. So we felt pretty good about it. One of the lessons that we learned from our pilot was that we were speaking to a different audience, so something needed to change. So rather than having sort of more of an educational hat on, like the in-person folks at the hospital did, we were speaking to a research audience. So oftentimes, who we were speaking to was different. And so the adaptation, and our patient partner said, we need to include a call to action in addition to talking about these moments of care. Because we have health researchers and policymakers in the audience, we don't want to waste this opportunity with these key people in the room. So that's where we added, that's how we adopted and made this our own to our own context. And that was, again, a result of working with our patient partners. Some examples of some calls to action, and Teresa will share hers in a moment, are how can you provide a better quality of life for dialysis patients? Or what can be done to improve how Indigenous patients are treated in the healthcare system in Canada? So this was an important shift for us, and sort of really, and was sort of an outcome of taking something that was sort of for in person, making it our own virtually, and then really considering what we need to do to really sort of make it our own for our own context. Okay, I'm almost done speaking. You're going to hear from Teresa shortly, I promise. But I just wanted to share what's happened since the spring of 2018. So between the fall of 2018 and the spring of 2020, so over 2.5 years, we delivered 3 additional synchronous online offerings to the patient partners in the CanSolve CKD network. We could take in this live synchronous version up to 4 or 5, 6 at the most patient partners. So it was a small group that we could sort of accommodate in these live online webinar series in this module. And then the pandemic hit. And as you know, many things screeched to a halt. And at that point, we didn't have any live synchronous modules planned. But enter Teresa, and I'm going to pass it over to her so she can share how she came into the network, and really through her involvement, how we've now developed the current tool, which is a asynchronous, completely at your own time online module. So I'm going to hand it over to Teresa.
Awesome. Thanks, Leah. So, although I wasn't involved in CanSolve at this point, I was actually working on some research projects outside of CanSolve. And one of them was with Geonome Canada. And I was working with a team out of the University of British Columbia, so UBC here. And they were looking at adapting um, the epitope matching into the criteria for kidney. Um, I'm so sorry. I seem to have lost my notes here. Uh, into kidney allocations for deceased donors. And, this was a very promising project and really exciting work uh, to do. And I was asked to share my story. And I thought, no big deal. I've done this for, many times over my 40 years of experience. And I didn't really realize I needed a storytelling course until they asked me to do that in 7 minutes. And I thought, uh-oh, okay. So then I met Leah and her amazing team of story coaches, and they ran me through a personal training session where I was able to make my story into a succinct presentation with a call to action. So my story was then talking about moments in my care where I had to lean into hope. And my call to action then was to make sure that although epitope matching in was an amazing way to provide kidneys that could potentially last longer for patients and provide better outcomes, that to make sure we didn't lose hope for patients, especially patients who were highly sensitized or had difficult to match. And because some patients may never be matched with the epitope matching. And the thing that I found out, or that I learned after sharing my story, was, I think I missed a point there, Leah. Um, how we did this was we had a public online deliberation. And so they gathered, from a survey they sent out, and we had 42 people who from across Canada, rural and remote, various cultural backgrounds, who attended the presentations that we gave. And there were many different components to this, and my story was only one part. And what they were doing was providing context of what was the ethical and um, implications of adding this epitope matching to the criteria. And the end result was that they actually did recommend that it was added, and that is still a work in progress. But they wanted to ensure that everyone would have still the fair chance to receive a donation. So they did add some criteria around that for the recommendations for the policy makers to consider. And, I never would have had that kind of impact had it not been for the storytelling course. I'd have never been able to make that kind of um, thing happen in healthcare and potentially create a future that would be even better for transplant patients. And so I'm very passionate about sharing storytelling for impact with others. And I've actually done that many times throughout my um, journey so far, um, since I've had this experience. And one of them I'd like to share is a friend of mine who had experienced losing her husband in a healthcare setting, and she didn't feel like she was acknowledged or even heard during that setting. And taking this module, she was able to actually not only help process some of her grief, but she was able to create a video and share her experience with healthcare providers. She was able to have a meeting and sit down with the actual healthcare team and talk about that experience. And they're now implementing her story into their um, education process so that people better understand how their work impacts the patients and the patient families. And so it was after I had the experience of joining the that Impact for Storytelling module with Leah that I joined the CanSolve Patient Governance Council. And of course, there were other Story alumni who were very passionate about their experiences. This is very empowering for patients to be able to do this. And so we were very passionate and wanted to help co-build the online asynchronous model. And some of the learning outcomes that the asynchronous model offers, so that, this is something you can do in your own time, but you have that written and practical oral story, because you practice with your coaches and you can share your lived experience and actually impact a healthcare audience. You have the tools to adapt your story from that linear story that we were talking about to those succinct moments in care, asking for a call to action. You have a message, you have a point, and you receive constructive and motivating feedback from the story coaches when along the way as to help you build your confidence. And we're growing that community of story alumni. And I can tell you, this has been some of the most impactful work that I have done. So on screen, we have a few examples of some of our patient partners sharing stories all across the globe. There's Leah and Kelly in Brazil, and we've got Charles with a quote there saying this is some of the most impactful work or the biggest definition of paying it forward that he can think of. So he's very passionate. And then Arlene and Kathy are there presenting in Manitoba at an Indigenous event. But I'd like to share a video from a friend of mine who has become a friend now, and Arlene. And Arlene attended one of the storytelling sessions, and she talks about how she attended and like she didn't want, excuse me, want to. She didn't even think she had a story to share. So let's have a listen to Arlene's story.
I chose to be a patient partner for my husband. He passed away 3 years ago, and during his journey, I always said if there was anything that I could ever do to use my voice to make it better for somebody else, that's what I was going to do. And when he passed away, that was absolutely a priority for me. Because I was so involved in my husband Glenn's care, and I was very vocal in everything that he ever needed, why not teach somebody else to do that? And if they can be part of a research project to help their own health, why not? Ask lots of questions, get involved. Don't be afraid to use your voice. I mean, a researcher doesn't know that you as an average everyday person want to be involved. You know, they're equally as keen to get you involved, but they don't know what you want to do. But you have to advocate for yourself. Express what you want to do, because they're there to support you every step of the way. And then you become more knowledgeable, and then you find out you actually do know a little bit more than you give yourself credit for. So, and I certainly learned that about myself through this whole process.
So she has an amazing story, and her husband lives on through the stories that she tells. Um, Thanks, Leah.
Yeah, thanks, Teresa. The way that you shared that really, whenever you share the story of your friend, it always gives me chills, because we can only hope that these are the kinds of things that are going to happen. Although we couldn't have imagined that creating this tool would help patients in so many different ways in their own personal lives and in the way that they interact with the healthcare system. So we just have a few more slides, and then we'll open it up to some questions and some dialogue. So these are just a few ways of how we're sharing our story of the Storytelling for Impact module that we've created. So I would encourage you, another thing to do after the webinar is to go and check out our online publication. It has additional supplemental materials, including a logic model for evaluation that we just don't have the time to get into here. And it also talks a little bit more about the narrative medicine lens that the folks in London used. And it was great that once this paper was published last spring, Lisa from the Patient Experience Office sort of tweeted and was sort of excited to see that the work that she started is carrying on. And I think, wanting to share a little bit about, the lessons learned during this 6, 7, 8-year journey of the different iterations of this Storytelling for Impact module. I think it wouldn't be what it is today without, if we didn't have patient partners involved from the very beginning. They ensured that the materials and the content that we were creating was relevant and accessible. We really went through this qualitative improvement plan, do, study, act, PDSA cycle, right? As every iteration of the online workshop that we did, we tweaked it and we refined the process. And, I think one of the other really important things that wouldn't have maybe happened if we hadn't partnered with patients was the emphasis to keep the peer-to-peer connection there. So what I mean by that is that our patient partners insisted that each time we delivered the live version, so this is before the online module was created, that we co-presented with a story alumni. So someone who had been through the Storytelling for Impact series, had written, practiced, and shared a story, then became what we call a story coach and co-led the next iteration. Strategically, we were thinking that this would be a really useful and sustainable way of expanding the scope and reach of the module, and we'll talk a little bit about that in a minute. But that the peer-to-peer piece and working with someone who had done the workshop as a story coach was really important, and probably wouldn't have had such a central focus if we weren't working with our patient partners. One of the departures from the original workshop here in London that we weren't able to fully incorporate is the role of the facilitator in the context of, you've got the patient and you've got the audience. Well, the facilitator plays an important role for setting the stage and holding space for this interchange to happen. So Lisa and her folks, if you remember earlier on, I suggested one of those articles. One of them is called Three Sides to Every Story. And we talked a lot about this when we were developing the in-person live online modules. And one of our patient partners, Mary Bocage, said, after she had gone and told her story, she's like, you'd have to create something for the event facilitators. Because they're all over the place, all over the world. We as CanSolve staff, we couldn't be at every single presentation. The more and more we were training folks, the more and more they were off spreading their wings and telling their stories. And it was sort of like impractical for us to be everywhere with them and all the time. So one of our story coaches, our story alumni, said, you have to create something for the story facilitators, for the event organizers, And so we did. We created that. And that was really important, valuable feedback. And then, Teresa's work and how she shared it with her friends and colleagues was really the impetus for creating the asynchronous online module. So again, it really wouldn't have been what it is today if we hadn't sort of partnered with patients from the beginning. And then, there's challenges. For us in Canada, we are challenged by geography. We have 5.5 time zones from west to east. And getting folks together in person, flying folks together in person to do this work is sort of impractical as well. So, it takes time to do this work online. And of course, our patient partners, many of them have full-time commitments outside of the work that they do. So not that it's a challenge, it's sort of like a remember that doing this work in this way does take time. And I think I was reflecting further this morning because I'm still, largely doing a lot of collaborative work. And I think it's important to ask people how they want to be involved. So an example would be some people like to receive a draft of something and give their feedback on the draft. Well, some people feel that they want to build the draft first because that feels more meaningful for them. So the sort of the lesson really is to not presume that how any of your patient partners wants to be involved. What level of engagement do they want to be involved? So it's always a conversation. And that would be sort of my little gem, just because that always kind of comes back up even in the work that I'm doing today is remembering that people like to be involved in different ways. So just wrapping up, because we are a research network, our priorities and focus do ebb and flow with the funding dollars. And so CanSolve CKD is in its phase 2. So we're supporting only 9, so half of the research projects. So the resources for staff to continue to build out and support this particular tool has changed. That being said, Teresa and I are very grateful for this experience because we've re-engaged with CanSolve and are actually speaking later this week with the leadership to talk about how we can continue to develop this work. So some of the things that we're thinking about that we would like to do would be create more of a formal evaluation of the impact. And so getting creative about how we can evaluate impact. Creating a more formal pathway for people who engage with the online module to reach out to a story coach. Right now, we've also heard our patient partners say loud and clear for many years, we want to hear the researcher stories. right? Because if you think about a balancing scale, right, we're asking patient partners to share and be vulnerable all the time. And they have said, we want that reciprocal relationship. We want to hear stories from researchers. So what might that look like? How could we use what we've created to enhance that relationship? Looking for ways to further engage our Indigenous patient partners and elders around storytelling. And how do we continue to build out a community of story coaches and alumni from the ever-growing network? How can we track that? How can we keep folks together? How can we sort of create a community of practice, if you will? So that's sort of what's to come, what we hope will be to come when we engage with folks. And just to wrap up, these are some other tools that the Training and Mentorship Committee created over the last several years. Only one of them is kidney specific. So you can see we've got Kidney Pro, so that just basically breaks down kidney research in Canada. Storytelling for Impact can be accessed by anybody. Knowledge translation principles. The learning pathways Indigenous specific and focuses on non-Indigenous folks, learning for them. Our patient engagement toolkit, that kind of stuff is much has you've seen the material in there kind of pop up in other places. And the newest one we've done is a patient partners and peer review module. That was, again, co-developed with patient partners and with the Kidney Foundation of Canada as well. So these are all the people that have been involved over the many years. I hope I haven't missed anybody, but you'll see that the patient collaborators and storytellers are a good number over the years. And lastly, this is how you can get in touch with Teresa or myself. You can check out our website, you can sign up for our newsletter, or most importantly, you can go right to the storytelling module and complete it yourself.